Feeling well rested in the morning does not always mean your body was protected during the night. Sleep is supposed to be a time when the brain recovers, blood pressure settles, and the heart gets a break. But there is a detail most people never think about: the position you sleep in can change how your body functions for several hours in a row. I'm Dr. Warren Hung. On this channel, I focus on helping you understand how everyday habits affect long-term health, especially as the body changes with age. If you find these explanations useful, consider subscribing so you can keep learning how to protect your health in practical ways. Let me explain why this matters more than it first appears. During sleep, your body is not simply turned off. Your brain is still active, your breathing continues, your blood is still moving through vessels that, over time, become less flexible. In younger years, the body can compensate for small changes, but after 55 or 60, that margin becomes smaller. Systems that once adapted easily can become more sensitive to pressure, oxygen levels, and blood flow patterns. One of the most important systems affected during sleep is your circulation to the brain. The brain depends on a steady supply of oxygen and nutrients. Even small drops in oxygen, or small interruptions in blood flow, if they happen repeatedly over many nights, can create stress on blood vessels. Over time, that stress can contribute to conditions that increase stroke risk. Another factor is blood pressure. Many people assume that blood pressure simply goes down during sleep and stays stable. In reality, it fluctuates. For some people, especially those with hypertension, diabetes, or underlying vascular changes, blood pressure can spike during the night without them knowing. These spikes are not always felt. They do not always wake you up, but they still affect the blood vessels. And then there is breathing. The way air moves in and out of your body during sleep depends partly on your airway staying open. Certain positions can make that airway narrower. When that happens, oxygen levels can drop for short periods. The body reacts by increasing heart rate and tightening blood vessels to compensate. This creates a cycle of stress that repeats throughout the night. Here is where many people are misled. If you do not wake up gasping, if you do not remember any disturbance, it is easy to assume everything is fine. But the body can go through dozens of small stress events during sleep without fully waking you. You may still sleep through the night, you may still feel okay in the morning, and yet, inside, the cardiovascular system may have been under strain for hours. This is especially important for older adults. With age, arteries become stiffer. The lining of blood vessels becomes more sensitive to pressure changes. The ability to recover from brief drops in oxygen is reduced. Conditions like high blood pressure, atrial fibrillation, and insulin resistance become more common. All of this means that something as simple as sleep position can have a stronger effect than it used to. There is also a pattern I want you to notice. People often focus on daytime habits, diet, exercise, medications, and those are important. But the body spends a large portion of life sleeping. If something during those hours is putting repeated stress on circulation or oxygen levels, it can quietly add up over time. Not in a dramatic way, but in a slow, cumulative way. That is how many vascular problems develop. Not from a single event, but from repeated small strains that the body eventually cannot fully compensate for. So when we talk about stroke risk, we are not only talking about sudden events, we are also talking about the conditions that make those events more likely. Blood pressure instability, vessel stress, reduced oxygen delivery. These factors can build over months and years. And the reason this topic deserves attention is simple. The position you sleep in is something you repeat every night. It is not occasional, it is not rare, it is consistent. That means if a certain position is placing your body under more stress, it is not happening once, it is happening hundreds, even thousands of times over time. At the same time, this is not about creating fear. It is about understanding something that is often overlooked and bringing it into your control. Because once you see how sleep position affects breathing, circulation, and pressure, you can start to make small adjustments that reduce that strain. And before we go deeper into the physiology, there is one specific position that stands out not because it feels uncomfortable, but because it can quietly interfere with how your body maintains stable oxygen and blood flow during the night. But that position tends to feel completely normal while you're in it. The position that raises the most concern in this context is sleeping flat on your back, especially when the head and neck are not well supported. On the surface, this position can feel comfortable. It can feel neutral. Many people assume it is even better for the spine. But when we look at what happens inside the body during sleep, this position can create a set of conditions that, over time, may increase stress on the cardiovascular system. Let's walk through this step by step in a way that makes sense. When you lie flat on your back, gravity acts differently on your airway. The tongue and soft tissues at the back of the throat tend to fall slightly backward. In younger individuals, the airway often remains open enough. But as muscle tone decreases with age, and as soft tissue changes occur, that airway can become narrower during sleep. This narrowing does not always block breathing completely. More often, it partially restricts airflow. When that happens, oxygen levels in the blood can drop slightly for short periods. The body reacts quickly to these drops. It increases heart rate. It tightens blood vessels. It triggers small surges in blood pressure. These are protective reactions in the moment. But when they happen repeatedly through the night, they create a pattern of stress. This pattern is commonly seen in sleep-related breathing disturbances, including obstructive sleep apnea. Large cohort data, including findings from the Sleep Heart Health Study, show that repeated nighttime oxygen drops and arousal responses are associated with higher risks of hypertension and stroke over time. Even if someone has not been diagnosed with sleep apnea, the position itself can still contribute to milder versions of this pattern. There is another layer to this. When you sleep flat on your back, especially without slight head elevation, the return of blood from the brain through the veins can be less efficient. This does not mean blood stops moving, but it can create subtle pressure changes inside the head and neck. Over many hours, and especially in people with existing vascular stiffness, these small changes can matter more than they would in younger years. Now add blood pressure into the picture. During healthy sleep, blood pressure typically dips. This is called nocturnal dipping. It gives the cardiovascular system time to recover. But in some people, particularly those with hypertension, this dipping does not happen normally. In fact, pressure can remain elevated or even spike during the night. Research referenced in guidelines, such as those from the American Heart Association, shows that abnormal nighttime blood pressure patterns are linked to higher cardiovascular risk, including stroke. When backsleeping contributes to airway narrowing and oxygen fluctuation, it can worsen these nighttime pressure patterns. So instead of steady, lower pressure, the body experiences repeated surges. Over time, these surges can place stress on the inner lining of blood vessels. They can contribute to the formation of small areas of damage where clots are more likely to form. And they can make existing vascular conditions more unstable. There is also the position of the neck to consider. If the head is tilted too far back or not properly aligned, certain arteries in the neck, such as the carotid arteries, may experience slight mechanical changes. These are usually small, but in someone with plaque buildup or reduced vessel flexibility, even small changes in angle and pressure can influence blood flow patterns. This is not about a single night creating a stroke. It is about a repeated environment where oxygen, pressure, and flow are not as stable as they could be. I want to address something important here, because this is where many people misunderstand the situation. Sleeping on your back does not guarantee that you will have a stroke, and not everyone who sleeps this way is at high risk. What matters is the combination of factors: age, blood pressure, airway stability, weight, underlying conditions, and how the body responds during sleep. But the position can act as a trigger or amplifier of those risks. I remember a patient in his early 70s who told me he slept perfectly. He would fall asleep quickly, stay asleep, and wake up without noticing any problems. But he often felt tired during the day and had difficulty controlling his blood pressure despite medication. When we looked closer, it became clear that during the night, his breathing was repeatedly restricted while he was lying on his back. He was not waking up fully, so he assumed everything was fine. But his body was experiencing repeated oxygen dips and pressure surges. And this illustrates something important about how the body works. You do not have to feel a problem for it to be affecting you. Many of the processes that increase cardiovascular risk happen quietly, especially during sleep. The absence of symptoms can feel reassuring, but it does not always reflect what is happening internally. So, when we look at backsleeping in this context, the concern is not discomfort. It is not how restful it feels. It is how that position can influence breathing, oxygen levels, blood pressure patterns, and vascular stress all at the same time, over many hours, night after night. And once you understand that, the next question becomes more practical. Who is most likely to be affected by this, and what signs does the body give when something is not as stable as it should be? But those signs are often subtle enough that they are easy to ignore. The people most affected by this are often not the ones who feel obviously unwell. It tends to be individuals who appear stable during the day, but have underlying conditions that make their bodies less tolerant of nighttime changes. Age is one of the biggest factors. After 60, blood vessels become less elastic. They do not absorb pressure changes as smoothly. The brain also becomes more sensitive to fluctuations in oxygen and blood flow. What the body could once compensate for quietly now creates more strain. If you already have high blood pressure, this matters even more. Blood pressure is not just a daytime number. It has a rhythm. At night, it is supposed to dip, but in many older adults, that dip becomes weaker, or disappears entirely. Some even experience what is called reverse dipping, where pressure rises instead of falls. Large population data, including findings from NHANES and long-term cohorts like Framingham Heart Study, show that abnormal, nighttime blood pressure patterns are associated with increased risk of stroke and cardiovascular disease. Now combine that with a sleep position that makes breathing less stable. You begin to see how the risk builds. There are certain groups where this combination shows up more often. People who snore regularly, even if they do not think it is serious. People who wake up with a dry mouth or sore throat. Individuals who feel tired despite a full night of sleep. Those with diabetes or insulin resistance. People carrying extra weight, especially around the neck. Anyone with atrial fibrillation or irregular heart rhythms. And those already being treated for high blood pressure. What makes this challenging is that the signs are often subtle. Take morning headaches, for example. Many people attribute them to dehydration or poor sleep, but in some cases, they reflect overnight oxygen fluctuations or pressure changes in the blood vessels of the brain. Or consider waking up feeling unrefreshed. It is easy to assume sleep quality is simply not what it used to be. But sometimes, the body has been working harder during the night adjusting to breathing resistance, compensating for oxygen dips, managing pressure surges. There is also nighttime waking. Some people wake briefly, turn, and fall back asleep without thinking much of it. But repeated micro-awakenings can be the body's response to airway narrowing. These events may not be remembered in the morning, but they still interrupt the normal rhythm of sleep and recovery. And then there is something many people rely on without realizing it: the absence of warning signs. If there is no chest pain, no dizziness, no obvious breathing problem, it feels safe. But stroke risk rarely develops with clear daily signals. It builds quietly through changes in blood vessels, pressure patterns, and circulation. This is where false reassurance becomes important. Feeling fine does not always mean the system is stable. Blood vessels can be under stress without causing pain. Oxygen levels can fluctuate without waking you. Blood pressure can spike without any noticeable symptom. These processes are silent, but they still affect the body over time. For older adults, this matters because the margin for error becomes smaller. A younger person might tolerate repeated nighttime stress without immediate consequence, but after 60, the same pattern can contribute more quickly to vessel damage, plaque instability, and clot formation. That is how the risk becomes real. Not through a dramatic event during sleep, but through repeated exposure to conditions that gradually make the brain's blood supply more vulnerable. There is also an important connection to circulation in the neck. The carotid arteries, which supply blood to the brain, can already be affected by age-related changes or plaque buildup. If sleep position and neck alignment add even slight stress or altered flow patterns, it may contribute to instability in people who are already at risk. Again, this is not about a single night causing harm. It is about patterns that repeat. Night after night, small variations in oxygen, pressure, and flow can create an environment where the vascular system is under more strain than it needs to be. And because these changes are not obvious, they are easy to ignore. Which is why many people only think about sleep when they cannot fall asleep, not when the body is under quiet stress during the hours they are not aware. The good news is that once you recognize these patterns, there are simple ways to reduce that stress. And small adjustments can make a meaningful difference over time, especially when they are repeated consistently. But the way you adjust your position matters just as much as the position itself. Once you understand what is happening during the night, the goal is not to create anxiety about sleep. It is to make small, practical adjustments that reduce unnecessary strain on your body. The first and most important shift is moving away from flat back sleeping as your default position, especially if you already have risk factors like high blood pressure, snoring, or disrupted sleep. For many people, side sleeping is a safer and more stable option. When you sleep on your side, the airway is less likely to collapse. The tongue and soft tissues are not pulled backward in the same way. Breathing tends to remain more open and consistent. That alone can reduce the number of small oxygen drops that happen during the night. There is also a benefit for circulation. Side sleeping can support more stable blood flow patterns and reduce some of the pressure changes that occur when lying flat on the back. For individuals with mild sleep-related breathing issues, simply changing position can noticeably improve nighttime stability. If you find it difficult to stay on your side, there are simple ways to support that position. A pillow placed behind your back can prevent you from rolling over unconsciously. Some people use a longer body pillow to keep the shoulders and hips aligned. The goal is not perfection, but consistency. Another adjustment that can make a difference is head elevation. Raising the head slightly, not sharply, but enough to support a natural angle can help keep the airway more open. It can also improve the way blood returns from the head and neck. This is especially useful for people who notice snoring, mild reflux, or a feeling of pressure when lying flat. Even a small elevation can change how the airway behaves during sleep. What matters is that the neck is supported in a neutral position. Too much tilt backward or forward can create its own problems. The aim is alignment, not exaggeration. There is also a simple check you can do without medical equipment. Pay attention to how you feel in the morning over several days. Not just whether you slept long enough, but how your body feels. Do you wake up with a clear head or with pressure? Do you feel restored or still fatigued? Do you notice dryness in the mouth or a need to clear your throat? These are small signals, but they can reflect what happened overnight. If there are ongoing concerns, frequent snoring, morning headaches, persistent fatigue, or difficulty controlling blood pressure, it may be worth discussing sleep quality with a doctor. In some cases, a sleep study can provide useful information. Clinical recommendations from groups like the American Academy of Sleep Medicine support evaluation when sleep-disordered breathing is suspected, especially in older adults with cardiovascular risk factors. This is not about assuming something is wrong. It is about checking whether the body is experiencing stress during a time that should be restorative. Now, let's bring this into a simple, practical framework you can use. Think of your nighttime routine in 3 steps. First, position. Aim to start sleep on your side, with your head and neck supported in a neutral alignment. If you tend to roll onto your back, use pillows to guide your body. Second, elevation. Keep your head slightly raised to support airflow and circulation. This does not require special equipment, just mindful pillow placement. Third, awareness. Notice patterns over time. Morning symptoms, daytime energy, and blood pressure control all provide clues about what is happening during the night. These are small adjustments, but they matter because they are repeated every night. And that repetition is what shapes long-term outcomes. If you take one idea from this, it is this. The body does a great deal of work while you are asleep. Helping it maintain steady breathing, stable pressure, and consistent blood flow is one of the simplest ways to reduce hidden strain. If this explanation helped you see your sleep differently, consider subscribing so you can continue learning how everyday habits connect to long-term health. And if something you heard today sounded familiar, a habit, a symptom, or a pattern, it may be worth paying closer attention to it over the next few nights. Because the goal is not to control every detail. It is to remove the small, repeated stresses that the body does not need. And those small changes, when they are consistent, can quietly support the systems that protect your brain over time.